Hi, it's Matthew Holt, and here I am. It is the February the 4th edition of THCB Gang. We have a great crowd today. Really looking forward to this conversation. And we have, I guess, we're almost getting back to normal in a kind of very obscure way, given what's happened the last several months. But now we have real policies and activity, and also, of course, the rollout of the vaccine all happening at once. And today to discuss it, we have Jeff Goldsmith from Veteran Futurist from Health Futures Inc., Robin Farmanfarmaian, multifaceted speaker, author, CEO from Palo Alto, California, Rosemarie from Massachusetts, CEO of Day Health Strategies, and then two men from New York, John Neptune, these days running Suntra Modern Recovery, and Fard Johnmar, an occasional guest on the gang here, who runs the digital health futurist from the company Inspectos. So that's who we have. That's what we got going, and I am looking forward to the conversation. All right, with that, when I said it, it's like we're almost back to normal, right? We have executive orders, we have stuff happening, but on the other hand, we still haven't really got a clear idea of what policies we're going to see that the Biden administration is actually going to try to enact and get through Congress. So with that, I'm going to ask everyone sort of what they've been seeing the last week or so, last couple of weeks since they've been on, and where they think we are and what they noticed. So I'll start with you, Jeff.
Well, I'm sitting here in Virginia, patiently waiting for the state health department to tell me I can be vaccinated. 27 million doses as of yesterday, close of business, and 6 million people have gotten both doses. So we've had the vaccine for 2 months, and we're a little short of 2% of our total population vaccinated. So that's the one I'm watching. I'm selfish interest. I'd like us all to be vaccinated the next time we do this call.
That's not so likely, although I would tell you my medical intervention, went to see my chiropractor, and he just got his second dose. Rosemarie.
Well, I feel a whole lot safer knowing that your chiropractor is vaccinated.
He did tell me that one of his employees refused the vaccination, but he wasn't able. He knows that one of them did. He doesn't know who it was, which is all weird. We should probably get into that because I've heard some pretty disturbing numbers last night about nursing home vaccinations. Rosemarie.
I think the main thing I'm looking at is the American Rescue Plan, Biden's proposal, and where that's going to take us, the 1.9 trillion, and whether all the talk about whether there can be any bipartisan support. I'm of the mind that we shouldn't waste our time on that. Probably because I'm in the midst of listening to Barack Obama's book, A Promised Land, and all the pain that he went through in our last Great Recession, which wasn't as bad as this one, and couldn't get Republican support. So I don't know. I don't tend to be jaded, but after immersing myself in that, I'm thinking we just got to go forward with the Democrats and get this done.
JL.
So I tweeted about earlier this week about Greg Abbott, the governor of Texas, who has said that he's very interested in extending the extension of telehealth to the people in the state past the pandemic. And the article that I texted highlighted the fact that while Governor Abbott may have this desire, he's got to work with his own state legislature. He's got to work with the Congress. He's got to work with the Texas Medical Association. He's got to work with so many different parties. It's like a multi-party, multilateral negotiation to make this happen. And, my observation was that we've got to do better than having all 50 states deciding on their own how to make this happen. I think the feds at some point are going to have to jump into this. My feeling is that I think the Biden administration will want to do this. They haven't talked about it so much, but I think there are issues around regulation, reimbursement, licensure that really need to be addressed if we do want to have a broad rollout of telemedicine post-pandemic.
I think Jeff wrote that book in 2003, and it was all done then. All right, Fard, I know you want to. That's obviously a hot topic that you look at a lot, but tell me what you've been seeing the last couple of weeks.
Sure. So, and JL, I just want to say hello. It's been a while since we
hey,
saw
buddy.
each other.
A long time.
You guys are like 5 minutes away from each other, somewhere on the East Coast. So, but you're trapped in your own houses.
Yeah, one of the things that I've actually been thinking a lot about is the intersection between health and economics. So one of the things that I think is interesting is we just saw a report that Romney is presenting a bill to have a $3,000 a year payment go. I think that's the max payment that goes to everyone with children. And so one of the big things that's coming out of the pandemic, in addition to the vaccination process, is the severe economic distress that a lot of Americans are in. And one of the things that I've been looking at is kind of this whole idea of universal basic income, and kind of these anti-poverty measures and what people are looking at. So it was interesting to me that in addition to the stimulus bill, that there's basically going to be some type of universal basic income for anyone that has children. And so what that means for a whole host of things, including healthcare and food access and childhood healthcare and those types of things, I think that that's a really, really big deal. And it's something that we've kind of been inching toward for, discussions over the last 5 years. But now that with the pandemic, I think the conversations are getting a lot more significant. And then in terms of the Biden administration, I tend to think that we're going to be seeing some really big initiatives being pushed out. And I think part one is the stimulus. And then part two, I think, is going to be the child health and the child poverty issue. And I think Romney coming out with his proposal is a really big deal. And I think we're going to see some rapid action on that.
No cynical comments about where Romney comes from and how many of his constituents have lots and lots of children, but they do.
That was the first thing I thought about too.
It's the Mormon Protection Act again.
Yeah, he's delivering for his constituents.
Absolutely. I did hear from someone, I have a friend who's in Utah, and I was on a Zoom with her the other day, that in Salt Lake City there's been a significant number of people who've disappeared out of the school district in terms of people who just got lost, and that's an issue that, as we talk about child recovery, is going to come back. Robin, I suspect you're not going to be benefiting from the $3,000 per kid, but
does it count? For
given the grief you're giving me before we got on about my children, but correctly so, by the way. Anyway, so
does it count that I'm child size?
All right, tell us what you've been looking at the last couple of weeks.
So I'm really keeping an eye on CMS, Medicare, and the hospital at home. So they have been reimbursing that during coronavirus, and I am hoping that they keep that in line. And so there are a number of programs that I've been watching, because if they show success, both in patient outcomes, but also reduced costs, then I'm hoping that CMS keeps those rules going forward.
Yeah, there's been a lot of conversation about that. I know that's something we can probably dig into a bit, because that impacts telemedicine and what we can actually do. And I was on a clubhouse where that came up, a clubhouse chat where that came up just last night. I did notice that a couple of hospitals who weren't doing much in this in the past were talking about it. Kind of University of Michigan talking about how they were sending a bunch of people home with devices, and we're still a long way from implementing the home properly. But I would say that I wasn't going to say this, but I saw a company called, I think it's called, God, I forgot the name, Canvasser, I'll have to look it up. Got $14 million this week in a Series A for making a toilet that can take your blood pressure, your heart rate, and a bunch of other stuff. And I've always been talking about informating the bathroom, and they actually now they really are. Because their idea was, well, you could have a wearable, you could do a simple device, but everyone sits on their toilet every day most of the time. So
it's connected to the internet.
Absolutely. Right? Well, I mean, it's connected. It's connected to everything, right? But it's going to take you. It's going to give you EKG and God knows what else.
Yeah, I know that product.
Yeah.
Yeah.
We should dive into that. My take of the week, my weird thing of the week is that the Lancet, right, published the results of a clinical trial for the Sputnik vaccine, and the Russian vaccine was incredibly successful, and now the Mexicans are buying into it, and they're going to be exporting that. And we're in a world now where vaccine geopolitics is going to come into this as we try to figure out what's Pfizer doing with Israel, and what's the AstraZeneca one going to be like, and is the J&J one going to be effective enough? And we're going to go through all of this, and we're still at a point. Catalyst Altitude just closed our little contest for the the Alliance for Better Health, IPA, in upstate New York, to figure out who's got a good way for messaging about messaging to people about their vaccinations. But I just saw a product this morning which was essentially using the technology from drug reconciliation, where you try to figure out, take a photo and use AI to figure out, or ML to figure out what drug is somebody actually on, so that you can do drug reconciliation for inpatients and discharge and all that kind of stuff, using the same thing to track the vaccine from the whole batch of vials to which person actually got what vaccine from which place, and can you mix and match the first and second dose. And there's a lot to be done in that area, but yeah, so I think information of the various parts of the body and what's going into it and what's coming out of it are going to continue on. So let's dive a bit. I mean, a bunch of us have mentioned. I haven't. I'm not sure I'm as close as some of you as to what's in the likelihood of getting the big stimulus, the $1.9 trillion or $2 trillion, whatever it is, stimulus passed. I know Biden had a meeting with some Republican senators this week, and there's a separate group working on it. And then there's also the circus going on with Lynn Cheney and the various QAnon members from QAnon, and what the Republicans are going to do with that. But what's our sense for what's in the stimulus? I know we talked last time a few of us were on. We talked about potential things that could go into it, but what's the sense for what's actually in there that's going to impact healthcare?
So I saw that there is the state money. So that I'm really kind of crossing my fingers that the states do get money to roll out things like the coronavirus vaccine, because the Republicans, when they came back, they actually wanted to send the states zero money. And so that one I'm keeping an eye on.
Well, I strongly suspect there will be a bump in the Medicaid match. I mean, they only did 6.2%. It's not enough. Medicaid rolls are up by about 10, 11%, Rosemarie, something like that. There's a bunch of poor states that they'll have to cut services or cut payments unless there's a bump in the match. So I'm sure that'll be in there as part of the state aid.
Right, and related to that is trying to figure out some way to close the gap for the 12 states that didn't expand Medicaid, and whether they can tackle that, at least on a temporary basis, unclear, but it gets really complicated. But it could potentially be done through the exchanges. So
yeah, I was go ahead, Joe.
And I was just going to say, I think one of the other things that's emerging is this notion of income caps on the stimulus aid. And I think Manchin is from West Virginia is pushing that. I think there's at least one other senator who is driving the bill in that direction.
Can you say a bit more about that? So what income caps on what aid to whom, and is that going to be connected to total premium caps for the exchanges, perhaps?
No, different issue.
Different issue.
What
So
he's
this
talking about is where the phase out is on the $1,400 checks. I just looked at this. The proposal that Biden had out, the aid finally disappears at like $300,000 a family, which is pretty hard to defend.
Right.
If you're borrowing the money from your grandchildren. And so, what's being talked about is beginning for the $1,400 to phase out at $100,000 a family and disappear at $150,000. That's what he's talking about.
And some earlier chatter I saw the income cap maybe even starting at 75,000. So
for an individual.
Yeah.
And 100 for the family.
So I guess that, I mean, how close am I? Again, I'm almost feeling that post January 21, we all breathed that sigh of relief. Everyone talked about it on the show and elsewhere, and I'm kind of like, now we're back to normal. I don't have to pay attention every day to what the craziness that's coming down the pike. So but we do know that we have. They are still going to continue on with the impeachment, and no one quite understands that. And Trump keeps on firing his lawyers and getting new ones. And there is still that crisis around that. We are seeing the crisis on the Republican side about what do they do about the members from QAnon and Laura Boebert and Marjorie Taylor Greene. What's the one from Georgia called? There's a bunch of stuff that sort of political theater is going on. But at some point, we've got this stimulus bill's got to go into the Congress and the Senate and actually sort of come out the other end. What's the sense for how the current healthcare system has been doing. We've had some conversations over the years, over the weeks and months on THCB Gang about how bad it's really been for hospitals. And we just saw the numbers come out. Both United and Humana didn't have great quarters because they were now finally paying out the stuff that had kind of been held back. So is our sense that there needs to be another big round in there like the CARES Act with a lot of help for hospitals, and what's going to be there given their lobby power?
There is, JP Morgan put out their survey for January, their hospital survey for January. And what it showed is, the hospitals had almost gotten back to normal business by the end of December. And then in January, they slumped back 5 or 6%. So there was a further disappearance of business. And I strongly suspect as well a tilt in their payer mix towards Medicare and Medicaid, that from a cash flow standpoint, they're probably going back into the red. I don't know if it's bad enough for another installment of aid. I don't know if what was in the $900 million bill that passed in December, there was some money in there for hospitals. I'm not sure it's enough, but it's nowhere near what we saw when things fell off the table in February and March.
And is the just Jeff on that, was the reason for that because they're now the payer mix is tilting because they got the burst up in COVID, in the regional press of Los Angeles? That's the cause of that.
Yep.
I guess
there weren't, what we saw last time, of course, were a lot of governments saying suspend your elective surgery and all that stuff. What happened this time was just a lot of places, particularly in the South and in California, just sort of jammed up, and there was no place to put them. Even here in Charlottesville, we've had a couple of times where our local hospitals have canceled their elective surgeries schedules just because they didn't have enough staff.
So I guess the question, the next question is, do they need money for January? I've been saying for a while they're all sitting on these, a lot of the big systems are sitting on these huge reserves, and perhaps part time they dipped into their rainy day fund. But then the other question, is what do we think is going to happen regarding the spread? I mean, we have the UK version, the South African version, gone as the Brazilian version, where they talk about coming in, and there's kind of this race on. I saw Bob Wachter tweeting the tweet storm about this, the kind of race between can we get people vaccinated enough in time to reduce the next round, or are we going to see another 4, 5, 6 months of real pressure on the hospital system?
Well, you notice the deaths haven't gone down at all. I mean, the deaths are a trailing indicator. We're still, in the high 3,000s a day. I mean, these are just staggering numbers. You look at the death curve, and it's just, I mean, we're still really hurting. And I think I wouldn't be at all surprised if people's vigilance and just exhaustion with the whole thing opened the door for another round of a fourth wave, or whatever you want to call it, in the spring. I'm really concerned. I mean, we really are suffering now from the complete lack of a vaccination plan from the Trump administration. And I mean, even we talked about this the last time we were on, the idea of 100 million doses in 100 days, that's nowhere close to enough. It's nowhere close to enough. That's 50 million people. That's 15% of the US population. So I think that there is tremendous urgency among the COVID task force folks and the folks in the White House to do a whole lot better than 100 million doses. And I wish I saw some evidence of a ramp up. I think there's a really serious concern that we do have a fourth wave.
Which would suggest we need more money for the health system, in the 1.9 trillion.
Is it money that's the constraint?
Well,
or is it just a complete lack of? I mean, our public health system isn't a system at all. I mean, it's incredibly poorly coordinated, and I don't think it's just a shortage of resources. It's a leadership problem. It's a division of responsibility. It's a new federalism problem. I think even if you flushed a bunch of money into it, it's not clear that you would get the alacrity of response that you needed to really get this thing back in the bottle.
I think there certainly needs to be some funds in targeted places. So I'm on the board of a community hospital, and I know community hospitals are hurting because they're in the crux of where the coronavirus hotspots are. So they have to push aside all the elective stuff that makes them any money whatsoever, and they have to go back. They already are under reimbursed rates wise compared to the academic medical center. You go on, and it just compounds and compounds because coronavirus. So they're filling this absolutely vital need, and people see that, and yet they're getting crushed without the resources. So I can certainly speak to the safety net hospitals are going to need an infusion soon.
Does anyone think that we have does it sound like there's much more for that coming in there? We've heard, Fard, you mentioned the sort of, the Romney part, or looking for kids and other areas. Do we see, is that conversation, trickling up, do you think? And will it be in part of the stimulus bill?
You've got a substantial lobby in Washington that's looking for this.
Absolutely.
The Federation of American Hospitals, the AHA, America's Essential Hospitals, they're all in there. So I don't think there's any shortage of advocacy.
And then
I do think the state aid, and the targeted aid that they're talking about, is I think really critical. I think to the Biden administration's credit, they were kind of blocked during the transition for planning around this type of stuff, which was a really, really big deal. They didn't have any sense of the vaccination plans. Right. They walked in basically on, January 20th, saying, well, we've got to figure out everything. And so, I think they're kind of behind the eight ball because they weren't prepared to step in and be able to ramp a lot of stuff up. So I do think there's going to be kind of a lag, and I almost see the stimulus, almost see the stimulus as kind of a kind of way to buy some time to be able to try to manage this in a little bit of a better way. But it's a big job because they had just very little preparation to be able to do this in the way that it needs to. And so that type of effort really takes months. So if the hospitals can get support for the shortfall because of all the fee-for-service and the elective stuff, and then also additional support for the COVID care, then that's going to be a really good thing.
And one thing I'd say is I think I saw the number of people vaccinated yesterday was 1.3 million. So if that number is 1.3 million, then I think they'll definitely be able to reach their 100 in 100 goal, right? 100 million vaccinations in 100 days. And if they're able to ramp that up significantly, right, get that up to 2 or 2.5 or 3, and if they can get a supply of vaccine enough, maybe in 100 days at the end of this 100-day period, we'll have more people vaccinated than we originally thought. Maybe more than that 15%, Jeff. Maybe 30%, and maybe maybe more.
Well, the one thing that really shocked me was reading this article in Stat by Nicholas Florco, which was about this guy Paul Mango at HHS, basically going to Congress and stopping them from allocating money for the rollout. No, it's an incredible article. Basically, he said they already got some money. This is in October, November, in preparation for the rollout. It's a staggering article. It's like, I think I couldn't come up with one more important public health initiative to be done than saying we're not going to fund it because we don't trust the states. And I think, that comes to Fard's point. The folks showed up on January the 20th and had to start pretty much from scratch. So, it's only been 2 weeks. We should give them a break. It looks like it's picking up. What I don't know is whether the supply chain, whether once we get past the fact that there are apparently vaccines sitting on the shelf, or there were those, which weren't getting used, or those people who were delivering vaccines in Oregon and got stuck in a snowdrift and then went down the line of cars and just started vaccinating people, with the 5 or 6, vials they had. What I don't know is whether whether we can pick up on the supply chain and start actually producing enough. Because what I'm reminded of, not least of which because I have an au pair from Colombia in my house, is that it's great. We're actually in a global scale not doing that badly, which is kind of sad. The Israelis are miles ahead of everybody else. The UK is kind of a bit ahead of us. The standard, the EU is way behind. It's across the board. But there are countries across the globe who aren't even started yet, right? And the Japanese are just getting started. But even you go to Latin America, and of course these places are currently in crisis, and B, it's not like we can fix America and be happy. Right? Because one thing we've learned from this virus is that one thing that happens in one place is going to show up somewhere else pretty quickly. And, so
Unless you're New Zealand.
But the levels but think about New Zealand, right? The levels they've gone to isolate and make sure that they're okay means that they've basically cut themselves off from the world completely. And they've also, killed their major industry. One of their major industries was tourism. The whole Lord of the Rings thing, which there was something. So my sense is we've got to think about, and we're back in the WHO, and we have an internet, we're back in the Paris Accords, and there's thank God that all happened, but we are still got to think about this, and it is, as I said a bit earlier, it is something the Russians, why wouldn't they take advantage of the fact you can get, and even the Chinese vaccine, it's about 50% effective, apparently in the Brazilian study. But it seems to me that we're doing better. We've got a long way to go. So yeah.
Well, one thing we need to be working on, and I say we, because we can't just say, well, now we got Biden, Harris there, and so now it's all on them. And they're, I keep encouraging people have got to lead from where they are. And one of the really critical things is the vaccine messaging. And I heard a great talk this week from one of the Boston area infectious disease experts who was saying, I cannot come in as the expert and talk to a group unless they're my peers, but you have to, and say you need to get the vaccine, that we absolutely have to have community advocates who are perhaps, and she was talking about teachers unions, for example, that you need to have a teacher who was against the vaccine, who then decided that they're for it, be the spokesperson. Any community that you're in, you've got to have a trusted community member being that spokesperson. And you can't just suddenly materialize those people. They need to be found and cultivated and brought into a campaign, frankly, to get the word out. And so we can't just be looking to Washington and say all this has to happen from on high. There's plenty that does need to happen, and I'm a big advocate for coordinated federal response, but there's also lots that we all should be doing at the local level, so that we don't end up with vaccines out there that people aren't using because they don't believe they should.
Yeah, I'd add one thing. So I think last time, Jeff, you were on a couple of weeks back, you mentioned there was a study showing that some, especially healthcare workers from minorities, African American and Hispanic, were very unkeen to take the vaccine. I heard a terrifying stat last night. I mean, it's true. I was on a Clubhouse call, and somebody who works in nursing homes said that they were about 95% compliance, or 95% uptake with their residents, but they were in some cases below 25% with their staff, which is pretty terrifying. So I don't know. I'm the world's worst communication person, as you all know, but what you're dead right, Rosemary. We need to. I haven't seen enough evidence of that. At one point, Obama was going to get his on national TV, and I know Pence,
all the former presidents. Well,
did they actually get it?
Did
they get it? I didn't see that. I saw Pence get his, which will convince
Rosemary made a really important point: is that this is political and cultural. It's not just scientific.
Sure.
And we've had 4 years worth of denial of science. So, the idea that you put a bunch of white men in white coats on television saying this is extremely important for you to do. The point that Rosemary made is a really important point, which is it has to be inside people's peer groups, inside their reference groups, inside their families, inside their professional circles. You're going to need to come at it from a whole bunch of different points of view and substantively address their concerns, not just dismiss them as wackos or whatever, but look at the things that people are saying or thinking that cause them to believe this isn't going to be good for them, and provide them the facts and provide them some emotional resonance.
And I'm all about we got to do this in parallel, because we're agonizing right now that we aren't getting enough of the supply of the vaccine out there, because the demand is exceeding the supply. But that's gonna get solved. And then I'm afraid that we'll have the supply exceeding the demand, and we're not going to close that gap. But we could, if we're working on that problem right now as well.
And one thing I'd also say is, let us not forget, who are the influencers in our culture, right? Yes, Fauci is a great influencer, and maybe the presidents are, but it's Instagram influencers, right? It's and paradoxically, it's the TikTok, and paradoxically, those are the people who are often seeding the most uncertainty about the vaccine, right? So it's almost like an information war that we're fighting, just like we fought in this last election, just as we've probably been fighting for the last 30 years. We have to get good information out to people and understand, who is actually influential in this modern era of social media and video and online activity that, for some of us here, as I look at our photos, we're maybe a little bit aged out beyond that community, But
I know. We need Amanda Gorman. We need Amanda Gorman to write a poem on this.
Right.
Amanda Gorman is the answer to everything. Absolutely.
That's what her Super Bowl message should be. That's
22
it.
She's prime, right? 22 years old. She's as hot as it gets. She's got to get on She's got to get on every channel: TikTok, Instagram, Facebook, you name it.
Isn't she only hot with liberals and Democrats and not the Republicans?
So we gotta find her equivalent, right? And we gotta find it. And seriously, we gotta find a country music star. I don't know much about country music, but find somebody, a country music musician who's loved and respected. Certainly, Dolly, I think, is a great example. Dolly is not a young person, but Dolly Parton, obviously, is tremendously influential. She gave Vanderbilt $1 million to fund their vaccine trials. Has not jump the line, even though she has the ability to. I think if Dolly Parton wrote a little song, little ditty about getting your vaccine, I think that would convince a lot of people.
I mean, I do think that taking people seriously about their doubts about the vaccine is, I think, the most important thing that people can do. One of the things that people are skeptical about is how quickly this vaccine was developed. And, people who are used to having vaccines take years and years to develop, and then there's kind of this new technology that was deployed to be able to get it done faster, is one thing. I think the second is the CDC and the authorities, the general people you look to for guidance, they lost a lot of credibility over the last year. There was the mask, first don't wear a mask and then wear a mask. I mean, I remember personally when they came out and said masks are not effective, I went out and actually I actually purchased them because I thought that's crazy. Masks are used by people all over the world. And so I do think we have to take people seriously in terms of their skepticism about this whole process, because to the normal person, normally, like I said, it takes vaccines a long time to be developed. And people are saying, well, am I going to be a guinea pig for this? Or is this actually going to be effective? So what I'm hearing from certain people is, they're saying, let those people take it first, and then if they don't die, then I'll think about it. And I think that kind of the credibility, the lost credibility in terms of messaging and and the fact that there's a lot of controversy around the vaccine mitigation efforts, which haven't been effective. The lockdowns haven't been effective. They've had severe economic impacts. So I do think that we have to take, when I say we, the people who are advocating for this, take that seriously, because those are legitimate concerns, I think, and they shouldn't just be brushed aside.
And there's also some missing facts. I mean, what about pregnant women? Is it safe for pregnant women to take this vaccine? Do we know?
Well, we don't even know if you can spread it if you had the vaccine, right? If you're immune, but are you spreading it? I literally have an employee whose husband is a resident at New York hospital and is concerned because, is he coming? He's vaccinated. He's probably okay, but he's going to come and give it to her, right? And until we know about that, and we know about kids. I mean, we're at the situation. You may have missed this because it's crazy news. The San Francisco district attorney is currently suing the San Francisco school district because they are separate entities. The district attorney and the mayor are suing the school district because they have no plan to reopen. I mean, I don't think that's crazy. I don't know how it got to that, but at the point now we don't know about,
Well, and they're going to take Abraham Lincoln's name off one of the high schools. That was my personal favorite. I think there's definitely something in the water.
Well, San Francisco's a crazy place, as you know, but I get taking, Washington was a slave owner, whatever. Taking Lincoln freed the slaves. I'm not sure why we're getting rid of it. It's also the best high school in San Francisco, by the way. But that's by the way. All right, talking about San Francisco, let's travel to the metaphorical place called Silicon Valley. I want to change the topic here and talk a bit about some of what we're having this week. We have this weird combination where now we have apparently unlimited amounts of money in these SPACs ready to IPO. And this week, it's been announced that we already had a bunch of SPACs go out, but two sort of classic, really old Health 2.0 companies are now SPACing out this week. One of them is ShareCare, and the other one is 23andMe. ShareCare started in 2009 by Jeff Arnold, ex-WebMD, with Dr. Oz, Oprah, and a bunch of famous people. Has bought like 17 companies, and they are getting rid of the SPAC out. They bought a company called Care AI, which is a AI company that does something that no one quite understands, run by the DeBrouwers who used to run Scanadu. And then the other one is 23andMe, which has been around since 2007, I think. Doing genetic testing, and there's raised some money. Anne Wojcicki, obviously Sergey Brin's ex, has been called that. Hang on, Sergey Brin's ex, also A-Rod's ex. You wouldn't probably have thought that at the beginning. Interesting comment on her personal life. Anyway, but what I wanted to say was, I mean, particularly Robin, Fard, and JL. I know you guys look at this a lot. There's always been this question, and I keep on raising it, and Jeff keeps on saying, Jeff and Ian Morrison, when he's on, keep on telling me I'm an idiot, but it's always been this question: is there enough money around to create an entirely new system out of these new types of companies, or are they just going to continue to support the current incumbents? It's always been that there seemed to be a problem with getting people interested in using their technologies and getting them into the mainstream, all this kind of stuff. We've obviously now had COVID, and at the same time, we have this sort of incredible amount of money that's pouring into venture capital. I was literally doing Health in 2.0 with Jessica the other day, and we were kidding that there was, we had a deal less than 100 million. How did that get in? Where it used to be just a couple of years ago, it was 5, 10 million, 15 million, in A rounds. What's your sense, sort of in the water of where you guys are? And perhaps I start with you, Fard, because you track this stuff very closely, as to where we are in the kind of, is there some kind of sea change going on in this wave of investment, or is it just kind of more of the same?
Well, I mean, I think we have to take a step back and look at what the reason that there's so much money in the venture markets. It's basically, with the level of money that came into the markets in March, what you're seeing across many different sectors, not just healthcare, but you're seeing it in financial services and other areas, is that there's so much money available, chasing fewer and fewer opportunities. I think the second thing is that everybody with COVID saw that digital health was hot, and people were leveraging these technologies and using them for all types of things. And so that's why you have, these huge rounds and all of this financing activity, because, now is the time to get the money. One of the things that I think about, though, is, say the vaccine is successful, the healthcare system, and, we've kind of had this change in behavior because of COVID, going into these more remote types of care situations. But the question is whether or not and how much that's actually going to continue once people start feeling like they can go back to their normal activities. So a little bit now, when I look at all the venture funding that's happening and all the various companies that are going after the money, the message that I think they're probably getting is that now's the time to get money. So if you're going to raise money, there's a lot of money sloshing around. There's you can put a deal up and you can get, 5 VCs running after you. This is the time, right? Because next year it may be different as people start to realize that maybe some of these companies, weren't as effective in terms of building up businesses as they thought they would be. So in terms of, incumbents versus newcomers, when you look at the payment flows in the United States and other places around the world, they tend to aggregate around the incumbents. So we just saw, for example, the Onduo, shift to doing more, everything care. And then we see the same thing with Livongo and the Teladoc deal and all these types of things. So what I tend to think is that the deal flow is high because there's a lot of money. But once reality sets in that not all of these trends are going to continue in the way that people think they are, then the money is going to dry up. And so in some respects, I think a lot of these deals are get the money while you can, because it may not be here next year.
Jill?
I will share my thought. I don't have a lot of data analysis or rigorous data analysis to prove this, but enough data points that I've gotten that I think this is true. I think that compared to, let's say, where we were in the halcyon days of Health 2.0, I think that many startups that are focused on digital health are taking much bigger bites than they were back in the old days, right? And the old days maybe being 10 years ago. I think what I've clearly seen is a huge move towards startups trying to be full stack around either a specific patient population, women, people of color, you name your demographic group, or a startup trying to own everything within a therapeutic indication, right? Menopause, fertility, or whatever. And I think what you're seeing people do is they're building technology, they're building process, and then they're actually trying to deliver that last mile of service. And they're also trying to do it across 50 states, right? And I think that really requires much more significant fundraising than you had in, let's say, the early days, let's say when ZocDoc in 2007 is doing its first fundraising, and $3 million is a lot of money to raise. So I think that's what you're seeing is start, and sort of this mirrors back to the beginning of your question. I think that a lot of startups are really trying to own much more of the value that's created in the delivery of healthcare services, and trying to own some significant component to capture as much value as they can, including the physician or nurse practitioner or whoever the provider is, trying to capture that value as well. So I think that's why you're seeing such significant raises. And I could cite specific companies, but I think that's a clear model that I've seen.
So what I'm seeing, I'm looking at it more from the regulatory standpoint and the CMS standpoint. So we've seen about $2 billion in funding in digital health companies, and $50 billion in M&A activity as of like December. And so these are really big numbers. But what we're seeing is the reimbursement path, right? The adoption path through CMS. Things like Viz.ai, when used with LVO strokes in the emergency room, is now reimbursed at over $1,000. Right. So we are seeing this path to reimbursement. And I don't think the money is going to turn off anytime soon, purely because once you've got that path to reimbursement, you can then be really adopted by the healthcare system as a whole.
Right. And one thing I say to follow up on what Robin says, remember, VCs are investors in hopes and prayers, right? And dreams and big ideas. And I think in a world, let's say pre-pandemic, where, people had a notion of what the healthcare system was and what was possible and what the future might look like, you might have had a certain level of willingness to make big bets. But I do think that with the pandemic and how the pandemic has fundamentally shifted, consumption patterns in healthcare, delivery patterns in healthcare, I think if you're a influential or a persuasive entrepreneur, I think you can sell stories that would have laughed you out of the room, 2 years ago. I think you can sell much more exotic stories now. There's many more 50-state telemedicine stories now that are being sold than ever before. And I think that, once you start putting pen to paper and building your models, well, hey, we're going to need $50 million to do that. We're going to need $100 million to do that. So I think that I don't think we should underestimate how much the pandemic has created opportunities for people to envision a new world that requires much more capital to get to that vision.
Well, it's also, the other thing I'd say is I kind of kid about ShareCare and 23andMe being around for 10, 12, 15 years, and people will desperately get their money back and spacking out that way. But if you look at the more recent ones, the people who are picking off a little bit of primary care and then growing out, this is the land and expand strategy. You got HIMSS, which has now gone out public, 3 years from inception to public. Roe is going to do about the same sort of thing. Now, they're outliers. They're unusual. Most of the companies that we've seen going out public have been around a while, but there may be opportunities. If you give somebody enough money, enough firepower, that they can go through and build a big business very quickly. And there's just a week, of course, where all hail Jeff Bezos. Is he the richest guy in the world, or is Musk the richest one? I can't tell which is which, but he's allegedly stepped back, although he's just hired someone else to do his dirty work for him, right? But it does show you, right, that the Amazon strategy of we can go into multiple different segments, land, expand, grow, and take a hit for several years while not take a profit, and basically force out incumbents, has worked in many other areas. Now, I'm not saying it's going to work. Jeff is waving me off already.
I'm just like, I'm back to Gartner's hype cycle. This is the most astonishing cycle of hype I've seen in the 40 years I've been watching healthcare technology. It's just an astonishing phenomenon. And there's what I don't think people got about Gartner is, you get all this publicity, all this money flows in, people start trying this stuff and either discover that it doesn't work or discover that it doesn't generate any cash flow, and then it crashes. The hard part, the fun part, is what happens after it crashes. And that's where the management team comes in. If you've got an adaptable, smart management team, they begin tinkering with the idea. They begin tinkering with the business model. They get that whole, product market fit thing right. And it takes years to do it. And the companies that survive that crash into the slough despond emerge as dominant actors in the market. Reggie Herslinger is the scholar of all this stuff and wrote an amazing and very effective piece in the Harvard Business Review in 2006 called Why is Innovation in Healthcare So Hard? And she listed all the barriers. And if someone really wants to make $1 billion in this field, they've got to think through all of that stuff that she talked about and have an answer for it. This is not just a flash of insight and a whole bunch of new money showing up and ta-da, we're all transformed. That isn't the way it works. It's hard work. It's a Darwinian process. Fundamentally Darwinian process.
I don't disagree, but I'm looking at this and going, there are things that weren't around before, right? So Robin mentioned the CMS sort of starting to think about paying for telegram. JL was talking about 50-state telehealth. There's a bunch of regulatory stuff that was in the way before. There's still a massive problem with consumer adoption, especially of the people who have chronic illness and behavior change stuff, and that stuff is going to remain really, really hard. I mean, JL's in some of the hardest consumer adoption, consumer behavior change business. You should talk about that in a second. But there's also kind of sides being aligned, and I'm seeing some of the money flow. I mean, if you look at what Optum's been doing in terms of putting its pieces together, and by the way, the CEO of Optum just became the CEO of United Health Group today, right? I think there was a rearrangement of the chairs in United Health Group. There's a lot of bets being placed, not just by venture capital money and flash in this happening. And, while there was obviously the 2001, 2002, 2003 crash and started spawn, and yes, it got Google and Amazon, and a bunch of other people started figuring out what to do during that process. Seems to me that we don't necessarily go into that, and it won't. I think you could argue very clearly that in healthcare and health tech, basically that stuff all went away until you got the government money for EMRs. There wasn't really a healthcare technology market that we'd recognize today in the 2000s. But it's not, my sense is that a lot of people are betting it's not going to be like that in the next decade or so, no matter how hard it is. I agree with you, Jeff.
But there's a great example. You had what is it, 50-60 billion dollars of federal money pushed into EMR adoption. And where's the EMR today? The users hate the product. It's enslaved.
The users hate the product, but the companies selling it are profitable, and the company.
Fantastic. Is that moving our country forward? This may be the only industry in the history of American business that has seen its productivity decline as it automated. This is not something that ought to make us feel good about these technologies. If we can't figure out how to use them effectively to free our workers, our caregivers, and to make it easier for us older folks, like the people that are on Medicare, to manage their own illness, this is all just a bunch of froth.
I'd agree. I mean, and the question, the open question is so my argument would be, and I made this back in 2008, 2009. Sadly, the recession came too soon, and the money came too soon, and the people that we basically created as the de facto kings and queens, which was Neil Patterson and Judy Faulkner, kings and queens, and between them, right, Epic, Cerner, and those ones, and their alliances with big systems that then basically got scot-free off monopolies, the Sudders of the world, to go out and acquire others and to build these castles and put these big moats around them. That was kind of the wrong mechanism. But my argument was that the wave of technology that we saw emerge at the same time, obviously the iPhone and Google and everything else that was coming up, took a long while to get into healthcare. Now you can argue back and forth that it's still not getting the healthcare and can't be done well, and that, but I think we're closer, and I want you to defend yourself in a second, Jail, here, to getting the right combination of services and technology to actually improve lives, and that we need to think about which organization, is there enough to back these types of organizations, and are they going to fundamentally make a difference? Compared, you can argue, Jeff, correctly, that we didn't change healthcare with all that big amount of technology we put into it, but I'd argue it's kind of the wrong technology, and the right set of technology with the right set of services and the right organizations might actually change the next 10 years. Maybe I'm Clark Hoogland.
So what I'd say is, I live in the digital health world, but I think much more about services than I think about technology. I think about figuring out what the right services are, and then figuring out the technologies that are going to facilitate the delivery of those services. So, here in New York, New York is a hometown of CityMD, right? So most people know CityMD, national urgent care brand, the dominant urgent care brand right now, that has really changed healthcare in New York City and in the markets that it's growing in now, because a lot of urgent care traffic that used to be part of hospitals and health systems and filtered into hospitals and ended up being high margin specialty care is now just being taken care of at a storefront on Broadway, right? I have a couple of CityMDs that are located near me. And I think that the technology that has made CityMD possible is more technology around case management, CRM technology, not like really exotic AI machine learning technology. Maybe they're injecting that a little bit here and there, but they're just trying to figure out, how do we give people a good experience? How do we give people access to providers? How do we make people happy? How do we give people a good bill that they can understand? And I think that is certainly in my own business, that's what I'm very much focused on. At some point we will eliminate all the doctors, right? And we'll also eliminate all the VCs and the lawyers and the accountants as well. But I think that in the near term, we have great providers. We just have a horrible way of stitching them together. So I think if you look at CityMD, they're trying to do that for urgent care. If you look at One Medical, right? One Medical and all the other guys who are involved in primary care, I think they're trying to do the same thing. How do we provide a great primary care experience? What select pieces of technology do we need to inject into that experience to make people happy? And I think that, you're going to see that, I think, through a lot of different types of specialty care. Again, I alluded to this before, but you're seeing digital health startups that are focusing on an indication, menopause, thyroid disease, you name it. And I think what they're trying to do is just say, what is the service that people need? And then what are the incidental technologies that make those services more deliverable? And I think if you can capture that, I think you can capture much more value. And I think you really start moving away from venture type funding to more private equity type funding. And I think that, certainly if you look at CityMD is not venture backed, they're private equity backed. So I think that's the pattern that I see.
I don't disagree. And I think, one of the things I'm seeing now that certainly wasn't around 10 years ago, not even 5 years ago, is full stack vertical clinics in different areas. I mean, there's a couple in diabetes, there's a bunch now in GI. You're starting to see them. Clearly, there's a ton of them in areas like addiction, substance use disorder, I know is the proper term, that you're in jail, and a bunch of others where, you go to one stop. And there's also the attempt to build this in primary care. Now, I would say that, and Jeff and I will both remember this, I was young and Jeff was pretty young when this happened. There were like 65 publicly traded physician practice management companies in 1998 or something like that, and about 2 in 2001, because whatever they did to try to create this organizational structure to do primary care plus or whatever it was back then, was a mirage. But I'd argue, and you will get a sale at this point. This money won't last forever by definition. But after that, I think we're building. I happen to believe that it looks like we have the potential to be building something new, not just repeating the 1990s and 2000s.
Well, but of course, what happens is that you get enough of these companies together and enough powerful backers of these companies, and then they hire lobbyists in Washington, and they put thought leadership pieces in Forbes, and you end up industrializing it. And that still doesn't answer the question of whether it's a business or not, and whether it saves money or saves time, which to me, it's like the whole ACO thing. I mean, there are successful ACO companies, but the idea has not scaled. And we've wasted a tremendous amount of societal time and energy trying to pretend that this was going to be a template for healthcare payment, and it wasn't. So, I mean, look, you know, I'm 72 years old. I'm a Medicare Advantage beneficiary. I am eagerly awaiting that Darwinian shakeout process to bring stuff to my home that helps me. And I'm looking for it. I am an active, aggressive adopter of new ideas that help me live to 100, right? And so, you know, if any of these work, I'm going to be a hungry advocate and consumer and cheerleader for them. But I think what gets lost here, our medicine, healthcare is a human service. It's the most complex thing we do in our economy. All sorts of ways can be found to improve the quality of that service, but it's the human part that really matters to me.
I think Papa will be sending somebody over. I don't know if they've signed up with your plan yet, but
I've got to buzz them through the gate.
buzz them
That's
in.
the key thing. I've got to buzz them through the gate.
No, I think-
So Matthew, one of the things I did want to say about this whole thing is, you know, you and I have known each other for a while. You know, I think the big question that a lot of people have is what's different at this time, right?
Absolutely.
So we had a couple of cycles of a lot of money coming in, a lot of excitement, a lot of energy, you know, people saying this time it's different. And each time there was kind of a wave that came in and then it receded. So, you know, one of the things that I spent a lot of time on working on is kind of trying to link together and stitch together the technology, the vision, and then the revenue. You know, so you know, who's actually going to pay for this, and then, you know, whether or not people are going to be interested in adopting these things in different ways. And to JL's point, you know, I'm also seeing this kind of full stack around a certain area, and then looking to try to extract as much revenue from that as possible. And so when, you know, I think it's really great to get excited about a lot of the numbers coming in, right? People get excited about that, but that the next stage is whether the revenue is coming in to support those businesses in a way that people expected. And so the Onduo, I'll just bring that up again, and some of these other pushes to kind of have these more full stack companies is because the revenue stream for, you know, say diabetes specifically or some other area isn't going to support a business. And so you see them actually expanding their efforts because in order to capture more of that revenue and to deliver the returns that they were promising. And that's for the care management. You know, there's other companies that are doing things in AI, you know, care management, population health. And so the question is, which of these companies are actually going to survive over time? And I think that there are some interesting things happening on the infrastructure of healthcare. And I think a lot of those companies will survive because they're delivering, you know, short-term benefit that can be measured by a CFO. But the question is, you know, how widespread is that going to be, and whether or not this time it's different. I think if we do see, more acceleration of the types of reimbursement stuff and the payment flows stuff happening over the next year, then I think we can probably say that this time's a little bit different because people will be able to get paid, and it'll be sustainable for all parties.
Yeah, I think it'll be we need a Reddit forum, right? You know, healthcare future bets, because this time it's going to be different. All right, we are very close to the end of our time here, so I'm going to do a quick go around for what people are expecting to see in the next couple of weeks. We'll have you all back on. So why don't I just go around left to right from what I can see? I'll start with you, JL.
I'll do a quick plug. Tomorrow, I am actually doing a Clubhouse discussion about the doctorless future of healthcare, an intentionally trolling title, but spawns a very
beyond Vinod Khosla. 100% of doctors replaced.
Well, Vinod Khosla is the father of the doctorless future. So, and I
80%. He didn't say doctor less.
That's true. That's true. I'm going to be doing that with Steve Wardell tomorrow. I'm also just looking forward to more pronouncements from policy pronouncements from the Biden administration about healthcare, specifically around new payment models and the support for new types of ways of delivering healthcare.
Jeff, what are you expecting next week or two?
2 shots. That's what I'm looking for. I'm looking for my damned vaccine.
All right. Well, hopefully you'll get it soon. Robin.
I'm looking at that hopefully $2 trillion package that's going to pass and what's in it for healthcare. So keeping a big eye on that.
Fard.
Yeah, I'm looking at the stimulus package and want to see what happens there. And then I want to see whether or not there's a movement to sustain a lot of the digital activities from a reimbursement perspective over the long term. And whether that's going to emerge. I mean, that won't be a few week type thing. That'll be some months, but I'm very interested to see whether or not these trends continue and how powerful they will be.
Rosemarie.
I think I'm looking at tying together a lot of things people have said just about this pandemic is so different and is driving some change. Like, you said 50-state telehealth, and you can see that in the short run, but I'm very curious about how this is seared into our psyches in the long run and how that changes our approach. Like, my parents were raised by people who were seared by the Depression and World War II. And that affected my upbringing. And then a lot of that was sort of thrown away as we became this very consumerist culture. But I wonder what the long-term effects beyond just, having COVID aftershocks and stuff, what happens in our psyche with the deprivation, what's happened with our kids, all kinds of things. I think we haven't begun to fathom, and there could be some good aspects of that. I always try to look for the good, but I'm curious about that.
Whoops.
It's a great point for us to end on. The long run impressions of, what happened in the Depression, what happened in the World War II generation, what happens with the COVID generation, how it's going to impact, not only us, but our kids and even our grandkids is fascinating and probably subject for several more THCB gangs and other conversations to come. All right. Well, want to thank my guest today, Jeff Goldsmith from Charlottesville, Virginia, Robin Farmanfarmaian from Palo Alto, California, Rosemarie Dave from Massachusetts, and the two New York guys, John Neptune and Fard Johnmar. Fard, I think it's in New York, might be in New Jersey. I can't quite tell where he is these days. Somewhere in that East Coast metro.
I'm in New York. Yeah, I'm in
New York guy. So this has been the February 4th edition of THCB Gang. I'm your host, Matthew Holt. Thanks very much for watching or listening if you're listening on the podcast. And we'll be back same time, same place, 1 p.m. Pacific, 4 p.m. Eastern, next Thursday, February 11th with another gang. Thanks for listening.